GW4W. Delighted to be here with everyone today, and wonderful, Chris, to be with you. Chris is our London lead and CEO of Personal Touch Fitness. So I'll pass it over to you, Chris.
Thank you so much. It's fantastic to be here again today. These Wednesdays roll over quicker and quicker, and we're the second one already, season 4. Oh my gosh. So I want to, joining us today as my co-host is Caroline Ribeiro Nelson. She's the head of Free Choices. And what is that? It's all about diversity and inclusion, and about mental health and well-being. She has been a consultant for 25 years, delivering training, leadership development, and everything else. She's a wonderful, wonderful woman. And I'm so pleased for her to be here to co-host today. And also, I can't forget to tell everyone she's a GW4W member, and she's on the advisory board. So thank you, Caroline, for being here today.
Thank you, Chris. It's great to be here.
Your first one for 2021 as well.
Yes, amazing. I'm so excited to be talking to Elizabeth.
And so our guest today is Elizabeth Bachrad, and she just moved from London, Wimbledon, wasn't it?
Oh, wow.
Wimbledon to California. Haven't you? Just over the
reverse.
Weekend.
Reverse.
Oh, the reverse.
Yeah.
The pond. Yeah.
So we're going to have a wonderful conversation today with her. She's a healthcare strategist. She's really into that design thinking and wellness. It applies to our careers and how we really take care of ourselves. With young children she works with, and she really, really loves to work with them because of the fact that it is about developing those skills on how we take care of ourselves. And how good is that? We need this as we go through the decades, and especially what we're going through today in the world with the whole virus. So we're really, again, looking forward to speaking to you, Elizabeth. But I first want to say quickly, just a little bit about you. We had a wonderful conversation back in December. You're a mother yourself of a 7-year-old daughter you have, and your dad had passed away 5 years ago, and we had a lovely conversation around that because it's all about choices. And I bring your dad into it because you said, look, Chris, I think if he would have made different choices, he probably would still be here today. So the fact is that this whole design thinking and wellness is something that we're really looking forward to speaking with you today. So as you are a healthcare design strategist, can you tell us a little bit more about what it involves and actually how you got started in this field of work?
Uh-oh.
I think she froze.
Elizabeth might have froze. Yeah, I think she's frozen.
Oh no.
Can we type her a message?
I'll type her a message
and then log in again.
Yeah, and we'll do that. So just, until we get her back on there, for those that are not as familiar with design thinking, I mean, simply put, it's starting to put together pieces of the puzzle that you may not think are connected, whether that's in your life, whether that's in your career. There's a lot of discussion about this in the innovation space, but also it applies to, how we're looking at our workplace now, because this whole big question about, well, what is work going to look like going forward from, we've been basically doing office work and factory work and these things with the same kind of work model that we've had forever, for 100 years, 200 years in some cases. And this, our pandemic and this current situation has given us an opportunity to kind of shake things up and make connections, to other issues in particular. I mean, there's no doubt that systemic racism, is now a much bigger conversation. And a lot of the, excuse me for saying this, but lip service around this has been uncovered. And we're saying that there is not just a connection to how this shows up in the workplace, but connecting it back to COVID and how these pieces are going to impact how people come back to work, mothers, caregivers, which I know, Chris, you mentioned, about Elizabeth's father. As you know, I just took care of my stepfather at the end of his life. And there is no doubt that if you are a caregiver, how you can show up and the flexibility that you need to do your job, that was a huge, it still is.
Mm-hmm.
But there's more of a recognition now that having a more flexible work schedule, being able to log in and maybe, do these things is something that more and more organizations are opening themselves up to. And, and strategically, it may give you as a leader the opportunity to hire people in different parts of the world, potentially, not just different parts of your country, and expand your ability to innovate, because the more diverse voices you have, not just having them, but building a community where everybody is heard and everybody can share and contribute has already been shown. We know that. So I know she's not back, but I know you do some of this work, Caroline. So until she comes back on, why don't you share some of the stuff? Because I know you're doing this crossover work too with diversity.
Yeah, definitely, Mim. And I think that the more people become aware of the issues that face people from diverse backgrounds as well as women, the more that they're able to recognize the great need that you were talking about in that flexibility to what are the particular challenges faced by these different groups, and that intersectionality as well of, for example, Black women going into the workplace that may be of a different gender or sexuality. What are those particular needs for that particular individual, rather than looking at people as a group? And I think that when people look at groups, they tend to then look at division. They don't see that we're all part of a community, and that we all have our different needs and challenges. And if we are open up ourselves to recognizing that those are things that if we bring those into the workplace and we try to develop strategies and structures and routines that actually protect people, make them feel safe and include them, that it's actually better for business. It's better for business, it's better for health and well-being. And we have to recognize that it so much impacts on mental health. And that's something that I very much focus on as well, because if we recognize mental health as much as we recognize physical health and the different challenges, then we can really move forward in a great way. Great, we've got Elizabeth back.
Yay!
I'm so sorry about that. I had to switch rooms. Oh, I'm terribly sorry.
It happens on CNN. It happens on View. We all live in this world right now. So no worries. We just kind of jumped in and talked a little bit about how it applies to, systems thinking in the workplace. So
beautiful. Okay.
So shall I, how much did you hear? Should I ask the question again, Elizabeth?
I didn't hear the question. I heard you talk about my dad, which is so thoughtful. Thank you. So yeah, please continue on with the question.
So welcome back.
Thank you. I'm in a new place. I've had to migrate around the house.
And I'm so pleased you came back to join us, because we really did want to talk to you. Okay. So you are a healthcare strategist. Can you tell us a little bit more what that involves, and how did you get started in this field of work?
Yeah, so I combine the creative and artistic aspect of design thinking with the qualitative and quantitative science of behavior change. And this wraps around into a beautiful application of looking at healthcare, which typically I focus on the non-clinical, which is more to do with population health. So I'm looking at all of the influences, the social and economic influences that interact with our health outcomes. And this is largely about social infrastructures and well-being and all of the causes, the social causes of our health outcomes, which is large, 60% of those outcomes. And I got started with this really out of curiosity. I was kind of a gym rat, always involved in exercise. And I realized quickly early on that I'll honor Dr. Martin Luther King Jr. in that I wanted to be of service to others. And and what that meant was interacting with in the exercise environment to cultivate experiences and environments that facilitated change and engagement in health. And that led me to a variety of community health initiatives. I worked in a nonprofit for over a decade in San Francisco, and luckily found some amazing business partners that joined me on my journey to integrate healthcare to, I'll talk about accessibility in a little bit, but not only to make it accessible, but to empower people to take ownership of their own care, but help them on this continuous journey and really be available and a trusted partner in their healthcare journey.
That is so, so beautiful. And I brought up your dad because what you just said there, you know, no one really knows this. I would say, as much as probably I do through what I got with that conversation with you, is that this helped you go to that next level, as well as when you saw that with your dad, is going through and really look at how you look after yourself and move forward.
Yeah, I'll touch on that a little bit too. So it was 5 years ago, 5 days ago, and you know, in that whole time, and even before, really, what I understood was that we have an opportunity to really think about what the environment.
Uh-oh.
Rose.
I think, yeah, she froze again. I'm sure she'll come back. I think she probably just needs to log off and log on again, doesn't she?
Yeah.
I think so. She just may have well, as we all know, if you're out there listening, we've all gone, oh, there she is. You're back.
I don't know what's going on. It's trying to hop onto Xfinity. So I don't know what you guys heard, but I'll kind of repeat. Yeah, so this whole experience of understanding our environments and how we can create them, and also the experiences. And so this population health really looks at considering all these social determinants and the social cues, and what I've understood over time, especially with my dad and what he went through, is that we need to connect as human beings on more of an individual, social, existential level in pursuit of high quality healthcare and good health. And this requires a lot of stakeholders. It requires the community, it requires government, it requires corporate, it requires all aspects of how we live and thrive to make these experiences part of how we move through our health journey.
Yeah. Elizabeth, what really strikes me from what you said is that we spend a lot of time and invest in the environment of children, of what's important for them to be safe, for them to grow, for them to be inspired, to be motivated. And when we become adults, we kind of lose that. And it's really about what you're talking about, that environment is really important, that nurturing environment that we need as individuals makes such a difference to our mental health and well-being, our community, our sense of being able to be productive and to be healthy really comes from the type of culture and environment that we create for ourselves.
Absolutely. And part of design thinking with that is in education, in childhood, and even into adulthood, is that we have to constantly iterate. We have to design, we have to test it, we have to iterate. And I think that's especially true around health and the well-being of our communities, is that we don't just design something and then that's it. Like, you know, go for it, right? We have to get that feedback. We have to ask questions. We really want to be involved in each other's lives so that we understand how to redesign and how to reframe. I mean, I think that's one of the huge values in how we look at healthcare now, is that in order to quote Steve Jobs, in order to do different, you have to think different. And, you know, that's so true for our kids and the fast-paced world that we've kind of come around to in the Western world. It's a constant struggle and opportunity to say, hey, look, you know, what is it what is it that really matters, and how do we cultivate a more human-centered approach to
There-
how we
that-
live our lives?
Yeah, that really sticks out to me, is what's important, because I think in this information overload society that we live in, and we're getting just bombarded with one thing after another. You've got video games, you've got, for kids, all of this. This idea to learn how to choose the right thing and then connect it to what that really means in your life. I can tell you personally, like, there are just days where you just feel like, wow, like you've been hit by a tsunami of everything, particularly in the world that we live in now. So what an incredibly important skill to teach younger people, so that, they're going to be our future leaders.
Yeah.
And, just having an expertise in one particular area is wonderful, but we live in such a, world where, I think from my perspective, for too long, somebody will make what they think is a good decision without any real thought process about who else that impacts, what it's going to mean 3 to 5 to 7 years out. It's all this like instant gratification. I got my quarterly return, whatever it is. And so I'm curious, like, because I know you work with these kids, regularly. What are some of the things that you've seen? What are some of the things you can share with us about what, how kids embrace this and where they're going with this training?
One of the most profound things that we've discovered is that the imagination is so powerful, and we lose that so much moving into adulthood. Not always. I mean, there are those special creatives, but kids just they just can go anywhere. And I think so. I work with corporations and populations a lot too, and it is so hard to turn that back on. And if you sit in a room with, a boardroom and ask them, okay, we're going to go crazy. And every idea is good, like wild, just go for it. It's so hard. And kids just have that, they have that space and they get to go there. And you see it, I have a 4-year-old son as well. And he'll just go off and play and with nothing around, and they just create these environments for themselves. So that's been really powerful. And also, one of the amazing things about design thinking is that it harnesses collaboration and collective, not group think, because we want to try to avoid that, but that we foster the ability to build on ideas, so that one idea sparks another idea. And maybe it's a bad idea, but that bad idea turns into a good idea. And so really embracing the idea generation, and then moving after, we go crazy with a divergent thinking to bring it back into convergent thinking and pull together these incredible opportunities for solutions that can change the world.
It's absolutely amazing, Elizabeth. So I think tapping back into that imagination, that talent that we have to go anywhere, as you were saying, really opens up so many possibilities, and allowing people the space to feel that they're able then to look at their different ideas, to be as open-minded as possible. And that taps into, diversity of different ideas and different experiences. I know, Elizabeth, you have a great passion for human-centered design and health equity. And it's really interesting to know what kind of challenges you've faced, and how does your focus address those kind of challenges?
So I'll start off with a little bit of data, because I know that is Mim always loves to
I love it.
know what gets measured. Unfortunately, it's rather grim, but I'll move into the positives and opportunities. According to the World Health Organization, even from 2015 to 2030, we're seeing healthcare spends on a national and global scale more than double into the trillions of dollars. And this is just unacceptable. But the reality is that the cost is not the problem. It's a symptom, and it's a symptom of us not understanding that in order to reduce acute care, to reduce chronic disease management and move towards prevention, that we really have to focus on those social determinants, on the social infrastructures, on the well-being and wellness. And what happens is with those costs is that we move to quick fixes. We try hacks, and we really do have some great innovations coming out. Technology, apps. There's incredible amounts of innovation coming through, but they really haven't adjusted the needle on improvements in healthcare and equity. And so that piece of it too is access. Access isn't equitable, and we have, and it's very siloed. So we have all these approaches that we see across the nation, across the world. But what we're needing to understand is that it's not the same for everybody, and including populations, even within an employee base. What works in one group doesn't work in the other. And so this equity issue is huge. And I think we really need to understand that in order to lower costs, because if the costs keep rising, healthcare won't be accessible. And millennials will spend about 50 to 60% of their income on healthcare over the course of their life. And you just think about how staggering that is. So, the access, absolutely, but this comes with trust as well. And I speak a little bit about health literacy with this in terms of equity, because in the Western world, the healthcare system just lacks a lot of trust. And that is in our doctors, in our understanding of how to take medication, how to not take medication, how we can create more opportunities for perhaps Eastern medicine to complement the Western medicine. And so this trust is huge, especially in communities of color. I mean, we see this a lot in the research that is one of the biggest predictors of success and promotion of health equity. So we need new storylines of value. We need to understand and think differently about how to move through this human experience and elevate it, humanize healthcare, and create environments that allow these voices to be heard, to allow diverse voices to be heard, to respond to what the communities are saying, and how we can really look at more at the social aspects of well-being.
Well, I really appreciate too that it's not just about hearing it, it's about taking action and meaningful action, because you can't build trust if it's just, and I think that's been a huge issue, but I think you also really bring to light this intersectionality. We talk about workplace well-being and gender inequity and, and DE&I, or, diversity and inclusion issues. And the truth is, so much of this is interconnected, and yet organizations still put all this stuff in silos. Like, they don't include any kind of health and well-being, really meaningful health and well-being training for leaders or managers.
Yeah.
Like, they'll learn how to do budget projections, and they'll learn how to do, some of these other things. But, but there's this lip service around the health and well-being of their organization. And, and it can never be homogenous. It's been the biggest issue, in the workplace wellness world, is that, one platform, or, we're going to just do this with no real understanding. And I will say this, Nancy Board, one of our co-founders, works in the mental health space in the EAP world. And the EAP that she's working with now, she's intentionally gone out and gotten providers, mental health providers from diverse backgrounds. And,
Absolutely.
and I think this thing where they said, oh, there's not enough, or it's hard to find. And, that's not, right. That's just not acceptable. Not acceptable.
I was just going to say, you can't even, it's unexcusable to use that language anymore. I can't find it. We don't need it. We need everybody on all levels. We are all the same people, and we need all different people from different backgrounds, different cultures. They bring a real different aspect of it to the table.
Well, yeah. And I mean, right. So why, I think about, like, do I really want, and it could be the greatest doctor, most wonderful guy in the world that understands menopause, and he's studied it inside and out, but he's never going to go through menopause.
Exactly.
Not in the way that a woman is. And I think that, how do you help somebody? There is a, it's cultural intelligence too, to have somebody to support you, a coach, or that piece of it, to not just have emotional intelligence, but cultural intelligence.
Yeah.
And I would hope that leaders have the insight into their own psyches to say, this was not my experience. And as much as I may, try to understand it and listen and make good choices around this, it may not be for me to be speaking about this, or I may need to listen to and act on this in a different way. And that may feel uncomfortable, but, so that's the other thing I would like to, just like the design thinking, like, does this get disruptive? Like, do you run up against barriers that like,
let's go
with
for
people?
I want to call it positive disruption. I'm loving this new term I'm taking on. And I think that I have some strategies around that, and it's largely about radical empathy. And we see the term empathy come through a lot. And sorry if you guys talked about that while I was dipping in and out of the Wi-Fi, but radical empathy moves it to action. And I think that's the huge part of it. With that too, not just attempting to understand, but another way to do this is through storytelling. And this is a beautiful aspect of design thinking that kind of gets lost in the model and the framework, because storytelling has some of the biggest influences on behavior change, on influence and engagement. And this is really, really powerful for cultural competency as well. And in order for us to move to that radical empathy and say, yeah, we're going to take action together, or what is it going to take to move forward? We need these tools. We need to be able to be trained in understanding the power of a story and the urgency that the call to action comes within it. And it's a value-based issue. So we move away from issues. How can we connect on values and move through that hopeful action?
Elizabeth, I love that idea of radical empathy, which is so important to connect us as human beings. And I think that if we can start to move in that direction and look at what are the values that bring us together and that work for us rather than against us, we really have a possible way forward. I know all the time we've run out of time, but I want to ask you one last question. So I want to tap your pearls of wisdom, Elizabeth, and just ask you, what one piece of advice would you give that makes the biggest and positive impact on healthcare in the workplace?
So it has two parts, and I promise I'll finish in time. But the one piece of advice is always have the voice of the people you serve present, especially diverse voices that are unheard. And in the workplace, these are your employees. It's not the customer first. The customer is there and will always be there, but it is your employee base. This means make well-being the North Star, that it's the strategy, not a strategy. And that in order to engage and maintain relevance with this continuous health engagement, we have to design the environment and make it relevant to all stakeholders, not the shareholders. And this is really about creating long-term sustainable change, long-term partnerships, collaborations, relationships, deepening those connections. So, we need everybody involved, and we need those diverse perspectives. And this will really help us on our continuous journey of redesign. And like I said before, committing to that process, committing to be able to iterate, to redesign. And that includes some ambiguity, that includes some uncomfortableness, but we have to be able to measure the progress, not just the outcomes. And in health and in well-being, the people know, they will tell you if we ask them. So that's my one piece of advice.
Yeah.
Wonderful.
Okay, thank you, Elizabeth. And so I think that with that approach, I love the fact that people are your biggest asset. Their well-being should be your major concern, and that there are diverse needs that need to be considered and met. And that is, I think that is huge, and I think that can make such an impact. So thank you so much for being here and sharing that with us.
Yeah, and I will add too, Elizabeth is, so more to come from Elizabeth, because as a GW4W member, we're actually going to offer an online, Design Strategy 101, come learn how to start to do this.
Oh, that's fab, Mim. That's
So
not to be missed, definitely.
really excited about that. More to come about that, but this is kind of a little sneak preview. So thank you so much for, for being a part of the GW4W family. And Chris, I'll let you close us out here.
Well, we invite everyone to raise your glass to good health and a more sustainable and inclusive future. So join us next week. We have Jane Stevenson, and we have Caroline and Deanne. I'm going to take a week's break. I'll be behind the scenes doing the admin. So I'm here, but I'm going to take that break. And we're really looking forward to speaking to Jane next week. Mim, do you have that white paper there?
I do, amazingly enough.
We have a very, very good white paper that's digestible. Please go to gw4w.org and download it. If you need any support during this time, please reach out to us. We would love to talk, support, and mainly listen. That's what we want. Our community is very open, and we would love to hear your thoughts. If there is a topic you would like us to discuss, please let us know as well. And on that note, thank you again, Elizabeth. And let's all raise a glass or a cup. And remember,
great minds sip together.
Until next week.
Bye.
Bye-bye.